Hello, everyone. Good afternoon for all the Central American and Latin American folks. Good morning in case you are the Pacific time in the US. Good evening if you are in the other side of the world. We are really excited to close our journey of today with this great session about the USAID vision on digital health. And for that purpose, we have today Amarin Saisho, that she is a technical advisor in USAID. She is a global health and international development professional committed to improving access to opportunity by leveraging technology and policy innovation. Amarin serves as digital health advisor, as I said, with the Center for Innovation and Impact at USAID, which is housed in the Global Health Bureau, applies innovative market-based and digital health approaches to accelerate impact for critical health issues. At CII, Amarin's work is focused on sharpening the way that USAID and other donors invest in and with partner countries to strengthen health systems. Previously, Amarin was head of monitoring, evaluation, and impact at Simprens, a UK-based non-profit biometrics company working to improve access to essential services and healthcare in the global south. Amarin was a researcher at the University of Cambridge and lived and worked in South Korea, where she was a Luz Scholar, second the Seoul Metropolitan Government's International Relations Division. Before moving to Seoul, Amarin worked in government relations at FL Strategies in Boston. Amarin was a Gates Scholar at University of Cambridge, earning an MPHIL in Planning, Growth, and Regeneration, and graduating with merit. And Amarin has a BA in History from Barnard College, where she graduated summa cum laude. So for me, it's a really huge pleasure to introduce Amarin and pass the floor with this last keynote of the day related with the USAID vision on digital health. Amarin, the floor is yours. Thank you very much.
Thank you for that introduction, and it's a pleasure to be with you all today. I have some slides prepared, so if you'll bear with me, I'm going to share my screen. Hopefully that's now visible to everybody. So here we are. Good morning, good afternoon, good evening, depending on where you're joining us from. As was just mentioned, my name is Amaranth Sickle, and I am a digital health advisor with the Center for Innovation and Impact, which is housed within the Global Health Bureau of the U.S. Agency for International Development, or USAID. I'm honored to be here with you all for Rakainsa's Digital Health Forum. And as was mentioned today, I'm going to be talking about USAID's Vision for Action in Digital Health, or for short, our Digital Health Vision. The Digital Health Vision is a policy document, and generally speaking, policy documents can be dry and might not be the most stimulating things to read. However, to share a little bit of personal history, the Digital Health Vision is actually part of why I joined USAID as an advisor. Previously, I was working with a nonprofit that was using technology to improve continuity of care. We were creating unique IDs that were meant to help people, especially those who didn't have formal identification documentation, to be able to access quality healthcare. But we kept on running into what I came to recognize as a systems level issue. And this systems level issue may be very familiar to many of you. No matter how well we designed our technology for one program, our impact was limited because the programs that we were serving were siloed. They didn't exchange data. And even when the health worker population that was using our digital solution and the client populations they were serving were the same populations between programs, often the programs had different funders. They used different softwares. They had different workflows, and they hadn't thought about interoperability and data exchange. And that lack of coordination and lack of data exchange meant that we kept building the same ID systems over and over and over again for different programs. And this prompted me to think a little bit more at the systems level about what investment decisions we as a community, as a global health community, were making, and what better digital health systems might look like, which is exactly what the digital health vision is about. And so I'm very happy to be able to be sharing it with you all today. This virtual room is full of digital health experts, but I'm still going to start out by defining what I mean when I say digital health, just so that we're all on the same page. My definition of digital health encompasses everything that is at the intersection of health and information and communication technologies, or ICTs. So this includes things like the digital hardware in use, like computers, tablets, and mobile phones. It also includes software platforms and systems, and also the data that these tools and systems enable. In this talk, when I say digital health, what I'm talking about is the systematic application of these ICTs, of computer science, and also of data to support informed decision-making. And that's decision-making at all different levels. So decision-making by patients, decision-making by the health workforce, and also by health institutions. And all of this has the ultimate end goal of strengthening resilience to disease and improving health and wellness for all. USAID's digital health vision was developed to address specific challenges that started to emerge as digital health solutions gained traction. So in this presentation today, I'll walk through the problem statement that prompted the vision, and then I'll outline how the vision aims to respond to these challenges and give some examples. And hopefully at the end, we'll also have some time for questions and answers. Historically, as the digital health space has evolved over the past 2 decades, we as digital health practitioners have gotten really good at thinking about digital tools and the data that they're enabling and how that data can support more informed decision-making and better health outcomes at the program level or to address a specific disease. However, for digital health to optimally contribute to a health system, unsurprisingly, it requires a system approach, an approach that's more holistic and more tailored to country needs. And that's why I've circled the box over here on the left. It's not enough to just think about a digital tool or the data that we need. It's important to be thinking about the country use environment, including things like infrastructure, policies, regulation, institutional and workforce capacity, how digital systems work together, and also how the system will be sustained financially over time. Historically, as I was saying, a lot of digital health investments have been at the program level. And this is in keeping really with how the digital health field evolved, with one program operating and succeeding here, and then another one here, and another one here. And this approach has been very successful in meeting the needs of individual health programs, but it's had some unintended outcomes. First, it can lead to fragmentation, as individual health programs recreate and redevelop digital solutions that use either the same or very similar information to do the same or very similar things. These duplicative systems create inefficiencies as they strain country resources and also donor resources. And one of the inefficiencies that develops as digital systems evolve in this uncoordinated way is that it makes it hard for systems to exchange data with one another. And that can limit timely access to and effective use of data for decision making. This image on the left here actually illustrates the challenge of fragmentation quite well. It's showing a mapping of digital systems that were present in Tanzania from 2017, so 5 years ago. The color of the bubble represents the focus area of the digital system, and the size of the bubble is the relative size of the program. And you can see just how many self-similar solutions were operating in similar areas. And each system likely involved some level of software development work, some level of customization, might have involved procuring hardware, training health workers, and that list goes on. That's a large amount of duplication of effort. And if these systems can't share and exchange data with one another, that's also a large amount of fragmentation. Fast-moving disease outbreaks like Ebola and COVID-19 have really underscored the negative impacts that these kinds of fragmented systems can have. The image on the right over here illustrates, it's a drawing that one of my colleagues made when he was working on Ebola. He was trying to map out on a whiteboard where all of the important health information was and how it was moving. And this health information was what decision makers were relying on to understand and address a deadly outbreak. And you can see just how convoluted this flow is. You've got different systems, you've got Excel spreadsheets, you even have some individuals' names on there. And trying to bring all of this information together takes time, which is exactly what you don't have when you're working to address a deadly virus. Zooming out to more general terms, this kind of duplication and fragmentation can have negative impacts across the healthcare system. So for health workers, they can face a higher burden for collecting data if they have to repeatedly collect very similar information from the same clients, but for different programs. And in fact, it might be that some folks here have even seen health workers carrying multiple different devices because they have a separate device for each of the programs that they're working on. That's not very efficient. This approach can also fragment data, which, as I was saying, makes it difficult for countries to get a clear picture of their health systems. And this can be especially painful, as I was saying, when you're addressing a fast-moving outbreak, such as Ebola or COVID. On the donor side of things, we see a reduction in the impact and the sustainability of the digital systems that we're funding. And this has an opportunity cost. Looking at digital health only from the program level means that we miss all the opportunities to invest in cross-cutting things like data architecture and infrastructure, which could go a long way in helping to address the challenges that I've outlined, and also help make the data that's collected through these digital systems most useful. This also has an impact on our ability to contribute to global goals like achieving universal health coverage, including access to quality and affordable healthcare. In a resource-constrained environment, when we fund duplicative systems, we'll have less funding available to support other critical health needs. So in response to these challenges, USAID created the Digital Health Vision in 2020, specifically to address these problems of fragmentation and duplication. And we focused on 4 pillars. There are 4 pillars to the vision. The first is assessing and building country digital health capacity. The second is advancing digital health strategies. The third is strengthening digital health architectures. And the fourth is leveraging global goods. And now I'm going to unpack a little bit about what I mean for each of these pillars and also give some small examples to make them more concrete. So starting with the first pillar, building country digital health capacity. What does it mean to build country digital health capacity? Digital health capacity is comprised of a number of building blocks within the digital health enabling environment, including things like leadership and governance, institutional and workforce capacity, and infrastructure. Supporting digital health capacity is a priority for us because digital health systems don't exist in a vacuum. In the digital health vision, we advocate for understanding the enabling environments where we're working, and then based on that understanding, investing in ways to strengthen the enabling environment. And this is important because digital health capacity and a strong enabling environment can help ensure that investments are able to be used and sustained by countries over time. And this is also in line with our agency's localization agenda. As a little example of what this can mean, the Digital Regional East Africa Community Health Initiative, or Digital REACH, invested in a 5-country digital health landscaping activity. This was a landscaping activity that used the Digital Health Index, which is a standard framework for understanding a country's digital health use environment. And the landscaping sought to shed light on country enabling environments to highlight both the strengths and the areas of improvement for the enabling environment. And in one country, Uganda went on to use these results to understand the gaps that they had in their enabling environment. And 2 of the issues that they noted were A, siloed digital solutions, and B, excessive reporting requirements. To address these issues, they started to develop shared services like a national client registry, a health worker registry, and a master facility list. Using these common elements across programs helped them reduce the burden of data entry and was a strong first step for them in breaking down silos. There are lots of different ways to invest in building country digital health capacity, and this represents just one, but I'm highlighting it to provide an illustration of what it can look like to assess and then invest to strengthen digital health capacity and the enabling environment. The second priority of the digital health vision is advancing national digital health strategies. A national digital health strategy is a multi-year document that identifies a common vision for how health priorities can be addressed through coordinated and strategic integration of digital health technologies. These plans can help all stakeholders, including donors, to align their investments so that everybody is rowing in the same direction and aligning to country priorities. If no national digital health strategy exists, it's important to think about potentially supporting countries to create one. A strategy is really a part of a country's digital health enabling environment, but we've called it out as a specific focus because in the absence of a national digital health strategy, it's easier for digital health systems to fragment and duplicate. National strategies give all actors and all stakeholders, including donors like USAID, a country-led plan to align behind and to support with coordination. And here's a brief example of what it can look like to invest in a national digital health strategy. In 2017, Nepal approved a national e-health strategy, which laid out a vision for an interoperable digital health ecosystem. The strategy articulated a governance structure, as well as plans for a costed implementation roadmap for that strategy. And that's important, as it can provide a framework that different government ministries and donors can use to organize and plan around. And this, in turn, can help prevent that duplication and ensure that investments are in line with country-set priorities, and also promote sustainability as the funding needs for digital health initiatives over time are taken into account. The third priority of the vision is national digital health architectures, how to strengthen national digital health architectures. National digital architectures, or also digital health platforms, lay out which digital systems are used to meet countries' health needs and how these systems will interact with one another to exchange data. They establish what types of applications will be invested in and how data can be shared across these digital services. I'm sure amongst this group, we've got some enterprise architects, but for those of us who might be less familiar with the concept of architecture for digital health, here's an analogy that I really like. If somebody asked you to go out and build a road, you wouldn't just pick up a shovel and walk out your back door and start digging right there. You would probably want to know things like, what kind of road is needed? Is the road going to be for bicycles, or is it going to be for 16-wheelers, huge trucks? Where is the road? What is the road going to connect? You might even ask for a map of the area where you're expected to build, so you know what you're trying to do. And that mapping is exactly what a digital architecture provides. And in doing so, it lowers the management and the cost burden of competing digital systems and supports that data exchange and interoperability. So here's an example of what it can look like to build and strengthen a national digital health architecture. In 2016, Ethiopia's Federal Ministry of Health published an information revolution roadmap to help plan how to use ICTs to address what they saw as a real growth in both the amount and the type of information needed by the health sector. As a part of acting on this roadmap, the Federal Ministry of Health also produced a national digital health architecture that defined the relationship they planned to have between different health information systems that the Federal Ministry of Health would support. And it also provided a roadmap for iterative development, taking into account that when you're dealing with software, it's not like a, big bang solution and then you're done. One important element of the Ethiopia plan is that they also included an interoperability layer. And this enables different digital solutions to effectively and in a really scalable way share information, which goes to address that data fragmentation issue that I've been talking about consistently throughout this presentation. The final pillar of the vision is leveraging global goods. Global goods are software and knowledge tools that are mature. They're able to be deployed at scale. They're supported by a strong use community, and they're often free and open source. They're also highly adaptable so that they can meet different country contexts and different needs. Leveraging global goods is one of the pillars of USAID's digital health vision because doing so can offer a variety of benefits. It can help prevent vendor lock-in because the software that is being used is not proprietary. It can also be easy to adapt and reuse these tools, which can help lower development costs for solutions and also enable more flexibility. for the example here, rather than focusing on a particular global good software, such as DHIS2, which many folks in the digital health community would already be familiar with, I'm going to highlight a global good knowledge product that USAID supported for the COVID response. To help with the COVID-19 response, USAID supported the mapping of different digital health platforms at a country level, and then matched these existing platforms to potential COVID-19 needs and use cases. And the aim of this work, the idea was to make it easier for planners, for implementers, and for donors to find already deployed digital solutions that they could then adapt and or scale to meet COVID-19 needs. In the end, this project wound up mapping nearly 3,000 digital platforms and produced 22 detailed country reports to help focus attention on promising places for further investment. The idea really was that rather than building from scratch to address the emerging COVID-19 needs, perhaps these platforms could be adapted or scaled to meet emerging needs, and that this type of investment could be sometimes faster, sometimes more efficient, and potentially more sustainable, enabling the solution to outlast the push around the present emergency and really support the whole health system over time. The digital platforms that we mapped are scheduled to be added to the Digital Health Atlas, and the country briefs are available online. By investing in digital tools in ways that align with these 4 priorities of the digital health vision, we believe we can add value across the health system. So for individuals, for health workers, for entire health systems, and even, hopefully for entire countries. That being said, digital health tools don't automatically lead to better provision of healthcare. They're just tools. And how good they are depends on how they're designed, how they're implemented, and ultimately how they're used. The vision outlines an approach to digital investment that we believe will help provide the attention to systems and processes necessary to support effective technology use. And these 4 pillars are designed to help USAID really champion and our partners champion and support and invest in the types of digital systems that can contribute to health system strengthening, improved care, and contribute towards global goals like universal health coverage. So moving forward, at USAID, we are working hard to put this vision into action. And as folks who have worked in large bureaucracies know and can appreciate, after you publish a policy document or a strategy, you have to do the legwork to then translate that vision into action. And that's exactly what we're doing at USAID right now. So we're doing this by looking at our own policies and processes, our procurement, our partnerships, our organizational and technical capacity, and how we can better track our own investments to make sure that we're investing in ways that are aligned. This field is rapidly evolving. So while the digital health vision encapsulated our best thinking from 2020, it's now 2022. Collectively, as a world, we've gone through a global pandemic and a pandemic response. And there are many lessons from that experience to learn from and integrate as we move forward. And that's why events such as Rakainsa's Digital Health Forum and the Digital Health Week are really so valuable, because they provide a space for that reflection and that sharing and learning. So I look forward to attending more sessions and learning from you all about how we in the digital health field can support better health outcomes for everybody. Thank you. And now, if we have time, I would be happy to take any questions that you might have.
Thank you very much, Amarin. We have actually a question from the audience related about the amount in the budget that USAID is investing in terms of the software, and specifically how much is invested in open source and free solutions.
That's such a great question. And this actually takes me to the implementation, how to walk the walk. USAID is a large organization, and there are health systems and investment decisions that are made within the Global Health Bureau. And then there are those decisions that get made at all of our individual country offices. And presently, we have no way of tracking all of those investment decisions. So that's actually something that I'm working on. How can we, we don't want to increase reporting burden, but we really do want to be able to understand how much money are we putting towards these things, particularly if, maybe we're funding to solutions that could have been one or something like that. So this is an area that we're working on, and I dream to one day be able to more effectively answer that question about how much we actually are investing. We're investing in global goods via a number of different mechanisms, actually through USAID. But one very good resource I would point you towards, if you're interested in learning more about the global goods that we're supporting, is Digital Square. So Digital Square actually keeps a guidebook that tracks the global goods that we're supporting. And hopefully that can be a good starting point to answer some of those questions. Thank you. Great question.
Excellent. Thank you very much. Related with the other donors, that sometimes is a challenge, right? To have the coordination between the investors, between the regional and global entities related with the digital transformation. How do you see this coordination at this point, and how is aligned the USAID vision, for example, with the global strategy promoted by WHO?
Sorry, so how can you rephrase? I was distracted trying to stop sharing my screen.
No problem. No, it's related with the different donors and investors and the regional and global entities, specifically the WHO globally, but in some regions, the regional office of WHO. In the case of the Americas, the Pan American Health Organization, there are different frameworks and strategies. How do you see in terms of the alignment between the USAID vision with these other frameworks in terms of the strategies and the investments?
That's a great question. I think at a macro level, there are a lot of efforts and tools and coordination guidance that's available within the digital health space, and that can both be helpful and sometimes overwhelming. So there are even resources that organize all of the resources. There's a very helpful page in the DIG, the Digital Investments Implementation Guide, that actually maps out all of the different resources that you can leverage at different parts of the process as you're investing in digital technologies. So that's a little bit around all of the different coordination mechanisms. You also see leadership, as you mentioned, coming out of the WHO, and there's an office there for digital health as well. And I believe that they're getting a new director soon, which will be very exciting, and I'm watching that space eagerly. And in terms of coordination in general, I think coordination happens in a number of different ways. There's formal coordination bodies. There's obviously bodies like PAHO, which do really wonderful work. And there's also informal coordination, as it's a close-knit community in some ways, the digital health community. So there's lots of informal sharing of information around, who's doing what and where are their needs and who's available to address those needs. Also within the relatively recent past, we saw the creation of the Digital Health Center of Excellence, or DICE, which really represents an effort at a more full-scale coordination and having a place where countries can come and share needs, interests, a place where they can potentially, put out a call for technical assistance or highlight some of the strong work that they're doing. And DICE can also act as that coordinating mechanism between different stakeholders within the digital health systems.
Thank you very much. Very, very important, this coordination. And as you say, DICE, it's a mechanism that is showing this kind of coordination. In terms of the internally strategy, or the internal strategy in USAID to put in practice this vision, I think that there are important challenges in terms to the adoption of this vision in the national level with the USAID mission. How are you dealing with this internal change management? Because it's some kind of change of the model, how the USAID is working around the world.
It's a great question. And actually, very recently, my colleagues and I, who are based here in Washington, put our heads together and had a bit of a strategy session around that. And at first, I was also focused on change management. And then I realized that we weren't even at a change management point. So we have the guiding policy. And then that we've been sharing out. And there's lots of emergent and really great work that's happening all over the place, because really USAID is part of a cohort within this digital health space of actors and stakeholders who have recognized that there are better, more aligned ways that digital health will flourish if we're able to invest in more aligned ways. The principles for donor alignment is a good example of that. And so that's all happening in an emergent sense. And then in terms of the change management sense, we're actually in the process of trying to understand what the best way for us to approach change management would be, because as you mentioned, we're a large organization, and USAID has country offices literally all over the world. And often it's those people in those country offices who have the best view into what needs to happen. And so one of the things that we're doing is we're creating technical guidance notes to be able to support our colleagues around the world as they do their program planning, give them a very practical tool to be able to incorporate these kinds of ideas and strategies as they make their annual plans. But this is all still very much a work in process, and the change management process that you've been mentioning is something that's something that I'm definitely learning a lot about as I go through it.
Thank you very much. Well, in terms of the time, we have a couple of questions. One related with the place where the people can find the USAID vision. I understand that there is a website related with that. If you can share probably through the chat box, it's important. Additionally, there is another question related with Guatemala, but I think that that's applicable to Latin America. Do you know what kind of initiative USAID is promoting in terms of digital health in Latin America? Especially, we know that Central America is one of the areas where USAID is working, Caribbean, probably other. Do you know any insightful digital health strategy promoted or supported by USAID?
That's a great question, and it's actually one of my personal weak points. Most of my work to date in my career has been focused primarily in sub-Saharan Africa and also in Asia. So it's actually, I've been very keen to learn more about this area, and have, I'm eager to learn more. I was having a side conversation earlier today about that, because we would like to be highlighting more of the good work that that's happening in the Latin American and Caribbean region, and that USAID may be actually involved with as well.
Awesome, and we are so eager to know about the LAC strategy of USAID to support with Recainsa too. So we appreciate too much, Amarin, for your time, for your insights. I think that the USAID vision is really important in terms of the investment that USAID is doing around the world in terms of the digital transformation. So thank you very much for sharing in this space and for joining us to celebrate the Digital Health Week. Well, I pass the floor now to Jocelyn for the closing remarks of all the sessions that we have today. So thank you very much to all the attendees during the journey of the day. And over to you, Jocelyn. Thank you.
Muchísimas gracias, Daniel. Gracias, Amarín, por esta extraordinaria presentación. La verdad que nos agrada mucho conocer el trabajo que USAID está realizando a nivel global y muy gustosos de poder compartir contigo y explorar posibles sinergias. Y bien, como si nada, estamos llegando al final del segundo día de actividades virtuales en el Foro de Salud Digital Recainsa 2022, Salud Digital para un Mañana Sostenible. Y bueno, tuvimos una extraordinaria jornada en la que conocimos de mano de referentes latinoamericanos y globales de distintos temas. El primer panel que tuvimos el día de hoy fue sobre historia clínica electrónica nacional en América Latina. Hablamos sobre el presente de algunos países y de la región y sobre el futuro. Tuvimos una extraordinaria moderación a cargo de la doctora María Isabel Iñigo, quien es co-chair de la Comisión de Ética, Seguridad y Privacidad de Recainsa, y como panelistas tuvimos al señor viceministro de Salud de Costa Rica, el doctor Alexei Carrillo, al ingeniero Pablo Orefice, al doctor Alejandro López Osornio, al doctor Walter Curioso, quienes nos dieron un extraordinario recorrido sobre la situación en nuestra región. El segundo panel que tuvimos, uno de los más esperados por la comunidad de salud digital latinoamericana, fue sobre inteligencia artificial para la salud. ¿Hacia dónde vamos? Una pregunta muy importante y que definitivamente nos colocó en la zona de meditación a muchos. Así que tuvimos como moderador al extraordinario Alejandro Mauro, y que bueno, los panelistas que tuvimos para este panel, este fue un panel global en el que tuvimos la participación de Rebecca Disler de la Fundación Patrick J. McGovern, de el doctor William Wicks de Microsoft, de Lucy Setian de Novartis Foundation y de Marina Rojo, otra referente y campeona de salud digital de nuestra región. Y bueno, el tercer panel, otro de los más esperados también por la comunidad de salud digital de Latinoamérica, fue el panel sobre avances y desafíos de la interoperabilidad en América Latina. Aquí Alejandro Benavides, a quienes ustedes conocen porque es el cofundador y el director ejecutivo adjunto de Recainsa, hizo un recorrido de la mano de referentes en el tema de HL7 a nivel latinoamericano. Contamos con la participación de Diego Caminker, de Fernando Campos, de Mario Enrique Cortés, de nuestro querido amigo y colega Víctor Medina y de César Galindo. Y bueno, finalmente acabamos de escuchar la conferencia magistral a cargo de Amaranth Sichel de USAID, quien nos compartió sobre la visión de salud digital de USAID. Nos compartió sobre los 4 pilares fundamentales de esta visión, que son evaluar y desarrollar la capacidad de salud digital de los países, avanzar en las estrategias nacionales de salud digital, fortalecer las arquitecturas nacionales de salud digital y aprovechar los bienes públicos digitales. Ella muy amablemente nos compartió el enlace, que sé que va a ser un material de estudio para todos nosotros. Finalmente, no quiero despedirme de ustedes sin invitarlos y recordarles que los días jueves y viernes estaremos llevando a cabo los talleres interactivos del Foro de Salud Digital Recaínsa 2022. 4 temas fundamentales en la agenda de salud digital de nuestra región y, por qué no decirlo, global. Vamos a estar desarrollando un taller sobre gobernanza de datos de salud, otro sobre ciberseguridad en salud, otro sobre estándares de informática en salud y otro será sobre arquitectura abierta de datos basada en OpenAI. Si están interesados en participar, aún tenemos espacios disponibles y pueden registrarse visitando nuestro sitio web, recaínsa.org. Yo soy Jocelyn Carías, gerente general de Recaínsa, y me despido de ustedes esperándolos mañana a las 8 a.m. en punto hora Centroamérica, 9 en punto hora Colombia y 11 de la mañana en punto hora Argentina. Feliz tarde, feliz noche a todos.